I started Bay Area Spine Care because I wanted to provide patients with an individual approach to their care. I found that working in a large practice, sometimes people get lost in between the cracks. It's difficult to manage patients. There's a lot of doctors and sometimes a lot of chaos in bigger offices. So at Bay Area Spine Care, we have a more intimate environment. There's a more personalized approach to taking care of patients, both in the office and outside the office. Even when you call, we have people answering the phones constantly, and you don't get lost in our practice. One of the main reasons why I became an orthopedic surgeon is because I like to fix things. I can remember as a kid growing up being in the garage and putting things together and taking things apart, and that led to this kind of natural ability to want to work with my hands and get a lot of gratification out of it. What's nice about treating orthopedic patients is a lot of their pain and disabilities mechanical in nature. There's things that are broken, things that aren't moving, the way they should be or the way they used to. People come in with neck pain, back pain, and don't want to have surgery, quite honestly. They're scared and they're nervous about having a procedure. They may have had friends or family members that have had surgery. And the good news is you most likely don't need surgery. In other words, there's ways we can manage your pain without surgery. For example, certain physical activities will help your pain. Core strengthening, physical therapy, sometimes chiropractic or acupuncture care will alleviate your pain. If those modalities fail, we have people that do spinal injections. So you've potentially heard of epidural steroid injections or facet injections. Those are modalities that control pain, and often people can get an injection and go months, if not years, without pain. Now that's not always the case, and then there is a percentage of patients that need surgery. If you turn out to be a candidate for spine surgery, the good news is here at Bay Area Spine Care, we have all the latest minimally invasive spine surgery techniques. We do all of our fusions through a minimally invasive approach. We use microscope. Patients stay in the hospital for 1 or 2 days. They're not in the hospital for weeks. They're not wearing casts. They're not stuck in bed. We do a lot of outpatient spine surgery, so patients leave the day of surgery. They go home feeling better. Sure, there's surgical incision pain, but that typically gets better in a week or two. The long-term goal is to get patients back to their normal functioning, and what I like about the techniques we use is that it doesn't involve a lot of rehab. They do well following the surgery, and within several weeks potentially if it's a fusion, or even a few days if it's just a decompression, people are back doing their normal lifestyle and their normal activities. I chose to get a PhD while I was in medical school because I was interested in basic science research. I found it interesting to study basic life cycle procedures and different types of biochemical and physiological parameters. I have an interest in publishing and doing research in both basic science as well as in medicine, and I felt like the PhD would give me a more formal education in the scientific process and allow me to be more analytical when it came to looking at results and ultimately drawing conclusions on how I would treat patients. I recently saw a patient back in the office. He was 3 weeks post-op. He was an elderly gentleman that had really severe spinal stenosis, and the poor man couldn't go for a walk with his wife to have dinner down the corner, 2 blocks down the street from where he lived. Well, I saw him back in the office 2 days ago, and he's doing great. He said he's already walked 2 miles. He goes with his wife to dinner now once a week, twice a week. They walk down to a local restaurant, and I can't tell you how excited I was to see and hear that the main thing that made him so happy was being able to walk with his wife to have dinner. And so my ability to give patients back their independence, my ability to make people feel better, particularly in such a short period of time, is what's really exciting about spine surgery.